I'm Andrea Beckstrom, and I am a psychiatric mental health nurse practitioner, and I am the medical director at Aspire Medical. I am married. I've been married many years, and we have 4 daughters, ranging from age 15 down to age 7. And so I feel like I get a lot of practice using my mental health skills, which I never thought it would come full circle, but it's so neat to be able to tap into those skills in kind of a sly way with my own children and just in relationships. After graduating nursing school at the University of Utah, I worked in the operating room at LDS Hospital, and that's where I met my husband, which was very fun, and I loved it. I loved being immersed in the anatomy and just getting to see the body, and that was fun. I did cardiovascular surgery and was a charge nurse there over the department, so that was fun, and it could get really intense when someone would crash, so I loved it, but I did know there was more for me to do. I always loved school and learning, so I did go back and got my master's at the University of Utah as well in the psychiatric mental health program, and I don't know what led me there. All I know is, looking back, I was supposed to be there, and I'm so glad I took that route, because I went from the sleeping patients in the operating room to hearing about people's stresses and hard times and difficulties, and about their struggle with mental health and how difficult it can be. And I have enjoyed every minute of it. And I also think that everyone has a story to tell, and either is struggling themselves or knows someone that has dealt with mental health. And so to be able to help with that a little bit has been wonderful, and I love it. And I love to continue to learn, how else we can kind of help the mental health crisis that's going on. I didn't say after school, and in 2008 I went to work for Valley Behavioral Health, which is where I have spent all my time since. I have been put in many different avenues there, which I'm grateful for. They kind of just threw me in, and I started working with substance use clients, which I had no experience I had the schooling, but then I was thrown into it and learned a ton. And then I have worked in outpatient, I've worked in an eating disorder treatment center, and I've worked at substance use residential centers, I would say, not centers, but homes. I've done children, adolescents, up to adults. Mostly in the last part of Valley Behavioral Health, I've been working with adults, which I loved, but I love any age. And among that, I've worked a lot with anxiety disorders, PTSD, OCD, some eating disorders, and then depression and bipolar, and the severely persistent mentally ill with the schizophrenia, and a lot with the substance use piece, which I said, and ADHD, so just a lot, and personality disorders. So there's just been a lot of variety, and which has been fun. It's been really educational and a fun experience. Just like when I knew I had to do more schooling, I knew there was more for me to do in my career. I wasn't looking for more, to be honest. I was doing telehealth at home. It worked well with family life and with how much bandwidth I had, but the opportunity came to come to Aspire, and I just couldn't pass it up. It just kept, even when I was trying to think about it longer and go, I just need to stay with Valley, that wasn't the right choice. I knew the more in me wasn't at Valley, and so I couldn't be happier to jump on board with such an amazing team, and I love the vision that is here at Aspire Medical. I'm excited about this role. I get to help not only hire providers and find the right fit of people to come work with the amazing team that's already at Aspire Medical. That you walk in and just feel a difference at this clinic. The first time I walked in and met with one of the providers and with the executive board, it just felt different in such a good way. So I get to help be part of that, which is exciting. And then I also get to help train. I mean, we're talking specific, like an academy of sorts, where I get to help teach about depression. How do you diagnose that? What are the main things you're looking for? Because there is so much crossover with anxiety and bipolar and the mood disorders. So to help there, and then to help educate on the prescribing piece. And we get to kind of mold what that will look like. And what we're really excited about is the continuity of care, I guess you could say, where it's not just the prescriber. They aren't just, the patient isn't just going to come in and leave with this medication. They're going to get education on it. They're going to know their treatment plan. And they're going to get little bits of help on barriers that might make it difficult for them to take the medication or to go to therapy or to follow up with a primary care provider for that matter. And I'm going to help train on why that's so important, that piece of getting all the pieces that make the client the whole person. When I was thinking about coming to Aspire, and I thought, gall, but leaving home, and that was just a hard pull for me. But someone said to me, Kate, you're seeing this many patients a week, but now you get to help educate and train providers who get to reach all the people, and I get to see patients as well. But they said, what a bigger impact that will have. So that kind of got me. I just love the idea that, first of all, there's a place where there's help. But specifically within Aspire, as I have touched on, but that idea of the therapist talking with the providers, and we talk with the therapists, and we can say, hey, we started this medication to target these symptoms, maybe follow up on that, and then they can give us feedback. To be able to get that well-rounded approach, I would, as a patient, would feel so much peace of mind knowing that people were that invested. And